Our next guest says the results could position Zepbound as a best-in-class weight loss drug. So let's get more with NBC News medical contributor Dr. Kavita Patel. Dr. Patel, this is huge. 94% possible reduction in type 2 diabetes risks. Just how much does this resonate with the medical community?
Yeah, Dom, it's a pretty big message, not just for the medical community, but as you just heard, 1 in 3 pre-diabetics. I would even say that as we expand just pre-diabetes screening, we might even find that that's a higher number. That's pretty astounding. So this is, I've always been a fan, as the evidence has come out, of not just the benefits of weight loss, but we've seen it now time and time again, not just with Lilly's drug, but also with Novo Nordisk around kidney disease, heart disease. We're also kind of testing it in the area around addiction, memory, prevention for other neurodegenerative diseases. This is truly a game changer, especially if we can prevent people from getting to the very chronic conditions, Dom, that are resulting in not billions, but trillions of costs to the healthcare system.
Hey, Dr. P, it's Tim. Thanks for joining us. I guess my question, though, is, didn't we already know this? Didn't we already know there's an addressable market? Didn't we already know that the pre-diabetes, treatment was something that was part of why this has been such a powerful story? And ultimately, I guess this is maybe our job, but this is in the stock, is my view.
Right. Tim, you're absolutely right. Yes, we already knew this. However, what I think you can say very safely from trials up until we got this SURMOUNT data on prediabetes is that so much of it really was on the primary kind of outcome of weight loss, right? We all know that that was in diabetics, but remember, and even in the SURMOUNT trial, we're really looking at the clinical endpoint of preventing diabetes, but looking at these surrogate markers as well as kind of the addition of the weight loss. Everybody had said, by the way, this is probably just the weight loss. I do think that that answer needs to be teased out. You're right, that's baked into the stock. I think what changes here is thinking about this as a preventive drug. Right now, for a pre-diabetic, I really have diet, lifestyle modifications. At times I can use drugs like metformin, and there's some other things that we can use, but we don't have much of an arsenal to give people. So again, I see this, we've talked about this, Tim, it reminds me of statin conversations. For the longest time, that initial indication was really to lower the LDL cholesterol. And it took trials like SURMOUNT and others, the analogous trials in the statin setting to say, hey, there's effects beyond just the lowering of your LDL. And that can be cardioprotective. That can help with metabolic syndrome. I think this is the same path. And that probably is not baked into the stock and probably not thought of in a more clinical, broader spectrum. Think about using this as a preventive drug, not just an obesity drug.
Hey, Dr. P, Tim was very clear what we already know. What do we not know? What sort of trials would you get really excited about? This one, again, it's great and the numbers are massive, but what are some other conditions that might really excite you? And what sort of trials are in the works right now?
Yeah, so we know, we've talked about some of the trials that are in the works around addiction. This is a dual, remember, with tirzepatide, there's kind of that dual mechanism, GIP, GLP. So we have 2 out of the 3 main kind of parts of the body that are being like agonized or at least mimicked and trying to decrease the metabolic pathway. So I would love to see this in other conditions that we know are affected by the metabolic pathway. That's everything from polycystic ovarian syndrome. We also know that there's like a metabolic effect in the perimenopausal area. There's so many things. I think the part that's hard is that what I need to see teased out is this just the weight loss? We just heard about the incredible weight loss at even the highest doses of 15 milligrams on tirzepatide. What if you didn't have that weight loss? Would you still see these metabolic effects? Many of us think you might. I need to see that trial data. That needs to be clean and clear. I know that this is exactly what Lilly is thinking about, is they're kind of continuing on and monitoring these patients in the SURMOUNT trial. But I know that this is part of the future. And don't forget about retatrutide. We haven't even talked about that because we don't have that data. But that's the one that's taking that triple G effect. And that is another place that I think we're going to see just as strong signals, not just for prevention, but for some of these other metabolic diseases. Again, we need to tease out, is it just the weight loss? And that explains everything? Or are there some other metabolic side effects? And I hope that that's what we can see more data on soon.
Dr. Patel, quickly, who could forget about Repapetride? I mean, none of us here, clearly. But my question, listen, there's an election coming up. How much of a game changer, I'm assuming this would be bipartisan, would getting insurance coverage mean for these companies and these drugs?
Yeah, I think that you heard the CEO say it very quickly. They need to go after this indication. I'm still pretty bullish on them getting a prediabetes indication. That doesn't mean that it's going to be easy. It just means that they have the data to support that and have the agency have a serious look at it. And then insurance coverage follows that. Don't forget, our very good friends thinking about the Inflation Reduction Act, we just saw those prices come out. The question will be, at what point in time will it take for a drug like tirzepatide to hit that IRA threshold where Medicare negotiates on it and we can see some changes to the list price? So I think first steps first, getting that clinical and label indication, and then seeing insurance coverage. But I think this is why people are going to say, is this just a weight loss drug or is it doing more than that? And we're seeing more evidence that it's more than that.